Is there anything to be concerned about when changing from a combined pill to a progesterone only pill?
So, so really the difference between combined pills and either estradiol only or progestin only, it's really symptom based. So a lot of OB-GYNs and practitioners in general will kind of start with the basic pill, which has a little bit of ethinyl estradiol synthetic and a progestin that's also synthetic. If that doesn't do the job, or if it elicits different side effects or symptoms, then they'll kind of deviate towards one or the other and figure out what's most likely to help with the condition they're trying to treat. So the reason that most people, or I don't even say most people, but the reason to start birth control kind of exists on a spectrum. One is for legitimate birth control, right, to not get pregnant. One is for acne or hormone imbalance from an androgen side of things. One would be for excessive bleeding or other issues with menstruation. Others are for dysphoria with mood, or even with just ovulation pain, different things like that. Endometriosis, another condition that birth control is kind of used for. Again, the primary mode of action is to inhibit the release of gonadotropins from the pituitary, so you don't get ovarian stimulation, and so you don't ovulate, and you don't have any disruptions up or down of the estrogen and progesterone levels. They kind of chemically go through a fixation point as long as you're taking the pill.
Do birth control pills cause depression?
They certainly can. Now, typically it doesn't happen kind of right away. It's really a buildup of a lack of ovulation and by proxy a lack of progesterone. Because progesterone converts into allopregnanolone in the brain, which is a neurosteroid that has GABA A activity, almost like a benzodiazepine, people will start to notice difficulties with sleeping, either just full-blown insomnia or just anxiety increases, and also just kind of a general dysphoria as a result of being on the pill, for more than 5 or 6 years. Now, I've definitely had clients that started a birth control pill, either for just controlling hormones during a sporting activity, or during a season, like for track, for example, that definitely start to gain weight and get mood dysphoria secondary to just changes in their body. So whether it's actually a neurochemical level or just a global how someone feels about themselves, it's definitely a common side effect across the board.
Will I gain weight while on birth control pills?
Most likely. So because of the fluid retention capabilities of both progesterone and estradiol, most will start to kind of feel either some tenderness in their breast tissue, some swelling in their hands and feet. The degree to which that stays over time really depends on nuance in the receptor dynamics of their own progesterone receptors, what progesterone they're on, if it has kind of aldosterone mimicking activity. A lot of the newer progestin-based compounds don't have a lot of cross-reactivity. So, drospirenone is actually one of my favorites if I'm going to use an oral birth control pill, because it has a lot of progestogenic activity, but zero androgen activity. So it's more likely to help with acne. It's more likely to help with polycystic ovarian syndrome, some of the kind of over-androgen presentations.
How do I know what kind of birth control is best for me specifically?
So really, that comes down to like the specific reasons that you want to be on birth control, right? So if you're doing it to avoid pregnancy, then really the best form is going to be an IUD. Whether that's hormonal or copper is really going to depend on how you perform on it, right? If it causes more bleeding, if it's uncomfortable, if it has any kind of issue, then there's a likelihood of that, but it's actually very small. So I advise kind of all my clients that are looking just for birth control to get an implanted IUD. Number one, because you don't have to think about it. It's there all the time. It's doing its job. It lasts for 5 to 10 years, and you really don't have to worry about it. As far as using contraceptives for acne or dysmenorrhea or mood dysphoria, that's really where the whole spectrum of tools really comes available. Personally, what I try to do in those cases is balance out the hormones in a kind of bioidentical or natural way, solely because there's an underlying issue that needs to be addressed, and kind of blanketing it with an oral contraceptive is just not a great idea, in my opinion. Sometimes it's useful to use a contraceptive to see how it works diagnostically, to kind of hit on, all right, it's a progesterone issue, or it's a progestin-based problem, or it's an estrogen issue, right? So sometimes that can be utilized in that space. But again, birth control, I definitely recommend the IUD class. If not, just kind of monitoring basal body temperature or cervical mucus changes, and kind of using that as a natural planning technique also.
I'm thinking of quitting birth control pills after 15 years of being on them. How can I mediate this in a way that won't affect me negatively?
Very difficult. So generally speaking, when you get off birth control, you're going to have rebound bleeding. You're going to have likely the issues that you started the pill for in the first place kind of resurface. With my clients, we take a very close-knit communication approach where basically we stop the hormones, we track symptoms over the next month, we see how long it takes them to have their next period, if they have breakthrough bleeding, if they have mood changes, if they have any kind of issues regarding their cycle. We'll start to track it once they get more regular and use either the Aneto urine tracker for fertility, or just hormone measuring in general. We might even get spot check blood draws throughout their cycle to kind of see where they're at and compare it to their urine studies. But there's really no scientific way to do it to mitigate most of the problems unless you're really tracking things as they move in that first month or two. Sometimes you can just do continuous progesterone, the P4, the bioidentical progesterone, when you get off of it to really mitigate a lot of the problems. But again, even then, you might get fluid retention, you might get the bloating. So it really is an individualized discussion to have with whoever your provider is.
What happens if you take birth control during menopause?
So this is actually a tactic that OB-GYNs will use when women complain of, the postmenopausal transition symptoms as kind of a hormone replacement therapy that's not bioidentical. That being said, if women are on birth control heading into the menopausal transition, a lot of them won't know that they're menopausal because you're not getting a period, usually because they're taking continuous birth control. So in that setting, right, you actually have to do some blood work to assess where they're at in their menstrual cycle. They might take a break from the pill to see if they get a response from a breakthrough bleeding perspective. And then also, again, using some kind of at-home urine tracker to see if their hormones are doing anything. But usually if someone's going through menopause, the ideal scenario is to not use an oral contraceptive, to get on a bioidentical hormone replacement regimen and then track symptoms, track bone density, track all the metrics that we're worried about in the menopausal transition afterwards.